All right, we are continuing on with Unit 2. This is Lecture 3. Now that you know all about neurons and how they fire and all about the different parts of the brain, we need to talk about how our brain is divided and what happens when our hemispheres don't communicate with one another correctly. The first thing I want to go over is how plastic the brain is, not literally, but our brain is an amazing organ in our body. It has so much plasticity, which means that it has the ability to modify itself after damage. The brain is sculpted by our genes and our experience. So if you have been denied a learning experience as a child, if you were never comforted, if you were never held, if you were never talked to and taught by someone else, your brain is not going to develop the same way that a normal child's would. For example, let's say that you become blind due to a traumatic brain injury. First of all, where would that injury have happened? If you said the occipital lobe, you would be correct. So let's say that you had an injury to your occipital lobe, you become blind. You can no longer see. Your brain forms and grows in different ways after a traumatic injury. And if you are blind due to damage in the occipital lobe, your temporal lobe, which is responsible for hearing, would become even stronger. Let's say that you go deaf because you've had damage to your temporal lobe. Your occipital lobe is literally going to become bigger and stronger because of that. So our brain is very plastic. It has the ability to repair itself after damage. And I'm going to show you a short video, a 5-minute video of a girl named Jody whose brain repaired itself after a hemispherectomy.
We are beginning to harness the brain's incredible ability to invent itself, then reinvent itself throughout life. This girl is a testament to the amazing resilience of the human brain. Young Jody Miller leads an idyllic life as a 9-year-old girl. You would never guess that she has undergone some of the most drastic surgery imaginable. Jody's first 3 years were textbook normal.
Happy birthday, dear Jody.
Then, about 6 weeks after her 3rd birthday, a storm of epileptic seizures took control of her brain.
She couldn't use her left arm hardly at all. She could barely use the left leg, seizing a good deal of the time, multiple types of seizures.
Ordinary life became impossible. Medicines did nothing, and the seizures threatened to turn fatal. Desperate, Jody's parents brought her to pediatric neurologist Eileen Vining.
We found her seizures were all coming from her right hemisphere. And we knew that there is virtually nothing else, nothing but Rasmussen syndrome that can produce that picture in a young child.
Rasmussen syndrome is a degenerative brain disorder that disrupts the electrical activity that makes our brains work. Tiny electrical explosions were flaring up in Jody's right hemisphere. The seizures became almost constant. She lost control of her left side. Only one radical treatment option remained.
We knew that she was never going to have her seizures controlled with medicine, and we knew that she and her family faced taking out that half of the brain.
Okay.
Dr. Vining recommended a daring surgery called a hemispherectomy. It would be performed by pediatric neurosurgeon Ben Carson.
The whole concept of taking out half of a person's brain would seem to most people impossible. Human beings are incredible creatures with a brain that is beyond belief in terms of its capabilities, to the point where we can take half of it out and still function in a normal way.
85% of our brain consists of the cerebral cortex, which is divided into 2 hemispheres, each with 4 main lobes. The cortex handles many of our higher functions. Areas on both sides control thinking, movement, and sensation. But the right side controls our left side, and vice versa. Jody would lose almost all of her right hemisphere, and the cavity would fill with cerebrospinal fluid. operation has to be performed with great precision to avoid damaging the parts of the brain that control Jodi's life functions, like heartbeat and breathing. The surgery went flawlessly.
What we're looking at here is an image, an MRI, that was done on Jodi after her surgery. And what it shows us is the fact that we removed her entire right hemisphere. And what we're able to see here is indeed her very normal left hemisphere and all the beautiful gyri of her cortex. And we can see right down the middle, the right hemisphere that was there is now replaced by fluid.
But how could Jodi function normally with only one hemisphere? It's because of a miraculous ability of the brain called plasticity. Our brains can actually change shape, creating new connections between neurons or brain cells to replace lost or damaged ones. Jodi's left brain started reconnecting almost immediately.
At least as good as this. And as I remember, he wore pink just like you. This young lady had half her brain removed, went home, I guess maybe 10 days later, and was already walking. She was ambulating. She was able to walk out of the hospital. And that's because her left hemisphere had such resilience, such plasticity. It was able to say, okay, something needs to move her left leg. Whoa. You gonna open it? Okay.
Jodi continues to work on training her brain to overcome the slight paralysis in her left side.
But enough, now that's very good. You need to do that stretching stuff, honey. You know that, don't you? Are you doing enough of it? I think so. Tell me something.
The human brain is just an awesome thing because every time I look at it, I say to myself, this is the thing that makes this person unique. It still is just such a wonderful thing to find a young person whose life now can move on, who's no longer having seizures, who's developing in a normal fashion. I take the good with the bad, and I say, this is a bad thing, potentially, that we have to do for an extremely good cause.
So, like we've been saying, our brain is divided into two hemispheres, the left hemisphere and the right hemisphere. The left hemisphere processes a lot of linguistic things like reading, writing, speaking, mathematical skills, comprehension skills. And in the 1960s, it was termed to be the dominant brain, that most humans walking around are left-brained. We know that now to not necessarily be true. In fact, we need both of our hemispheres to function as a normal person. But as with Jodi, if something were to happen due to the brain's plasticity, we can absolutely function. Our brain can retrain itself and function normally. Now, with the hemisphere specialization, what connects the two hemispheres with one another is the corpus callosum, which is that fiber. It's a band of fibers that connects the two hemispheres, and it allows them to communicate with one another. If something happens that corpus callosum was split, the two hemispheres could no longer speak to one another. And it's clear that each hemisphere appears to specialize in certain functions. We just said that the left hemisphere was dominant for linguistic skills. The right hemisphere is almost dominant for creativity and things like that. Unfortunately, for people who have severe seizures like Jodi and like Joe, who you're going to meet in just a second, the only way to fix their epileptic seizures is by splitting the corpus callosum. So they will literally have brain surgery and they will split this band of nerve fibers. This is the corpus callosum right here. They'll split it in half. You can see a view here of the corpus callosum. And that, believe it or not, by hindering the two hemispheres from communicating with one another, can cause those epileptic seizures to stop. So what ends up happening is your left side of your brain controls the right side of your body, and the right side of your brain controls the left side of your body. So when the corpus callosum is split, there's no communication between the two hemispheres, which ends up being pretty difficult for someone to do certain things. In split brain patients, when they are looking at certain things, if the, let me see if it we'll skip to this. Here's a split brain patient. If you were to tell a split brain patient to look at the dot and then you have the word heart flash, HE on the left side and ART on the right side. And if you ask the split brain patient, what word did you see? They're going to say art, because they saw art in their right visual field and they're using the left side of their brain to say, I saw art. If you ask the person to point to what word they saw, the person is going to point to he, because motor function, while it is processed in both hemispheres, comes mostly from the right hemisphere. So let me, why don't we pause here? I'll start a new lecture so that you can meet Joe.